Good morning, Dr. Ritchie. It's a pleasure to have you here with us today as fall comes into Western North Carolina. Thank you very much for spending part of your morning with us here and joining our provider series. As we've talked a little bit about leading up to this, the provider series is just a few videos of people therapists, professionals, clinicians who are already using telehealth as a platform to provide services, and we're just kind of exploring that. And I know that today we're going to get a little bit into couples work, which is something that has not been covered yet, certainly not anything I have done from telehealth. So I'm looking forward to learning from you and hearing how we approach it. But let me ask you first to maybe just give us a brief introduction of yourself. I don't do that. I'll leave that up to you to say what you'd like to say about yourself. But
Okay,
thank you, John. Welcome.
Oh, thank you. And thanks, Cecil, for having me. And it's good to spend some time with you. I've been in the mental health field, I guess, 45 years, started out as a counselor, became a licensed psychologist. After a few years of being in a couple of counseling positions, I became director of Western Carolina University's Counseling and Psychological Services Center for about 30 years. And then I retired, and then I expanded my private practice for the last almost 10 years. And I'd started that earlier, so I've been in private practice part-time for 35 years. And I think probably the biggest change in the last 10 years is that I'm seeing a lot more couples. Over a third of my caseload is couples. And I'm also seeing a lot more senior people. So, and I've enjoyed both of those populations.
Yeah, I've noticed in my own practice that as I've aged, my clientele have also aged with me,
Right.
Which has been very gratifying and interesting and provides more opportunities for learning. And I know you also had developed expertise in working with men's issues at one point, and I'm sure that's carried forward as well.
Yes, of course, when I was working with college students, that seemed really important. But yes, as I've gotten older and kind of gotten into conscious aging and really working with, like one of my experiences, the older men, often because of a divorce or the passing of their wife, are often alone, and because they're no longer working, their kids are in other states, and so it's been really enlightening to me to see really men that are really, had a life that was full and lots of interactions suddenly change greatly, and then to deal with that. And then, of course, with COVID, that's been accentuated with the sense of isolation.
Right. So had you come into the telehealth realm prior to COVID, or did COVID bring you to the telehealth, M-Health, as it's also known, platforms?
Yes, it was all due to COVID. I considered it before, and but I just sort of anticipated that there'd be a drop in the quality of the therapist-client relationship just because of the distance and not, feeling the same energy in the same room and not having all the visual cues of the full body and such. So I just kind of didn't consider it. And then, and then it came, and since March of 20 and until April, that was all I did was the telehealth. And I've been really pleasantly surprised, and most of the clients that I've seen have, said they've been surprised that the quality has been as good, and that, they just didn't experience that much of a drop, in the experience.
Right. And that tracks closely with my experience as well. From both my own end of the camera and what I'm told by consumers on the other end. And that also fits very well with literature and research that's coming out on the national scene, that the overall consumer satisfaction is by far heavier on the satisfied end than the unsatisfied end.
Right.
From sitting in your chair on your side of the lens, what have you seen as pros and cons of the provision through this model?
Well, I think the most obvious up front is it's just more convenient, in that now someone can just sit down and click on a link and then be engaged for an hour to an hour and a quarter. Whereas when they're having to drive and around here, being in a rural area, a lot of people live, like a half hour away, but anywhere, even if it's from 15 minutes on up to an hour, it can easily expand that time to 2 or 3 hours. And so, particularly for couples, because now I'm dealing with 2 people scheduled, and oftentimes one might be at home or, work not on irregular hours, but usually one is kind of an 8 to 5 job, and usually they prefer, my last appointment time is 4:30, so they usually like that, but that means that if they have to drive, they sometimes have to leave before 4, or at least by 4. But with the telehealth, they can just shorten lunch a little and start at 4:30, or they can fit it into the lunch hour. So it just makes it a lot easier to have the session. Also, what I've noticed is once in a while someone will contact me and say, well, guys, something just came up. I'm going to be 10 or 15 minutes late, or I'm going to have to cut the session short, 10 or 15 minutes at the other end. But if we switch to telehealth, then they can do the whole session. Right. So that's been a nice plus. And then I found, when I was seeing people in the office, I'd say about a fourth of my clients would take notes. But when I'm online, I would say over a half of my clients take notes, because if they're sitting at a desk or a table, it's just so easy. And they really like that. They like being able to, they can, they don't have to just try to remember what happened. They've got it written down. And then there's, of course, the health issue. I mean, of course, if you're doing telehealth, you don't have to worry about the COVID virus. But I found also, it means if someone has a cold or a flu, they don't have to worry about passing it on or picking it up from the other person. So that's been great. And then I think there's just so many more options. I have, somebody on telehealth can be at work, they can be at home, they can be in their car. They can do a hybrid thing. I have people that'll start in person to decide if they want to continue with me. And then once they've decided to continue, they'll switch to telehealth. So they get to do both. I have the option with couples that, oftentimes people at first think, well, they're going to be on the same frame because, there are couples sitting by each other. But often by necessity, one has to be at work. And so they're on different screens. But some people like that, because then they're always looking at the full face of their partner as they're talking, versus if they're sitting together, they kind of have to look back and forth between their partner and me. So some people kind of like that advantage. And then I think, just like now, you're actually a foot and a half away from me. So even though it seems like you're further away, with the program that I use, someone's face kind of, the screen, 90% of the screen has the person's picture. And if they're fairly close to their screen, I actually, in many ways, can tune in easier and see their facial cues and what they're saying easier than if I'm sitting in an office where I'm maybe 5 or 6 feet apart, in terms of knees, but maybe even 7 or 8 when it comes to face-to-face eye contact. And so sometimes it actually feels more intimate because you're just so close through the screen. So I think, and also now that I ask that people that come, because of the Delta variant, I ask that people that come in person wear a mask, and I do too. So then we're looking at, in person now, I don't see the full face. Right. And so it's true that on telehealth, I don't see the whole body, but I can see the whole face. And so it's kind of a trade-off, either way has its benefits.
Yeah. you hit on something I've been aware of just in the evolution of service provision going back. As you said, we both have 4 decades plus in providing services. And I recall in my early training, it was don't sit behind the desk. Don't have anything between you and the client. It's da-da-da-da-da. It's not, and through the years, I never really had too many consumers get upset because I was sitting behind the desk, and if I was, and when computers got introduced to the sessions, nobody ever got upset about that. And so now here we are, a whole cycle, evolution's gone by, and not only do I, not have a desk between me, I've got miles between us.
Right.
And I think, and again, people are just generally have not been dissatisfied with that.
Right.
Yeah. And the aspect of seeing the whole face, I know there's a lot of research that's been going on around the term Zoom fatigue, and something I've tried to chat with each of our participants about it has been around that issue. And I think your points about seeing more of the face and picking up cues perhaps easier than you in the office setting. I know Stanford University research that came out was about how it's so much more overwhelming for providers because some of our senses are not utilized the same, and there's a much more cognitive load on us as far as paying attention and dealing with those, just dealing with looking as much. Have you had any particular experiences around feeling Zoom fatigue or just getting worn out from dealing with this particular platform?
Well, I suppose what's helped is I'm seeing about now half in person and half telehealth. So I think I would if I saw like 3 or 4 in a row on telehealth without a break, because I tend to go about an hour quarter. So 3 would be almost 4 hours straight. But usually that doesn't happen because usually 1 or 2 of those 3 I'm seeing in person. So actually I don't experience the fatigue, but it's because of the breaks. And I want to speak to another thing of that I've noticed is that the cancellation rate really isn't any different between the 2. So it's not like telehealth has somehow led people to be less invested. And in fact, my experience is there's more of a commitment because it's so much more convenient. And so I actually I think in some ways it's not a deterrent. It actually allows someone to be more frequent, allows them to come more often because they don't have to take off as much time, or it's not as much of a hassle or whatever. And particularly with couples, because oftentimes the one who calls is more committed and they're really invested, and the other one sort of agrees, but they come along. And, in the past, they maybe have been able to get by saying, well, I can't really take off that extra time. And now, they really can do it much easier.
Yeah. Speaking to the couples work aspect of this, I know from experience that sometimes couples can get agitated with each other and
Sure.
get going pretty good in a live session. And I'm curious, have you developed any new approaches to managing people on 2 separate cameras who may be in separate locations if and when they get into that animated dynamic level of excitement and growth?
Well, what comes to mind is often the times that kind of works out by how they choose to do couples. I've had a couple cases because they get so quickly triggered. They almost kind of prefer being in different locations on different screens, because it just gives them a little sense of distance, whereas some really want to be in the same frame and right next to each other. Now, at first I was concerned because I was thinking, well, usually when I'm in an office, I have each sit kind of diagonally, so, and a few feet apart, so that, you don't want them to have to turn that way next to someone, right beside them. And so I thought, well, the screen isn't really that large, so how's that going to work with telehealth? But I found, like almost with everything that comes up, there's always a creative way to deal with it. And so oftentimes they'll just put their laptop or iPad at a further distance, so I can still take them in sitting further apart. Or I have had a case where they'll put the iPad kind of right diagonally behind one of them, and so I can clearly see the one who's at that time the major speaker, and the other one's, being there to listen and respond empathically and such. And so I can get them in a regular position that I would if they were in the office, just with a little different angle. So there's lots of ways to handle that. And sometimes, when people have tension, I shift to something maybe nonverbal, like an activity. I have a chair exercise where someone sits in a chair and moves in a couple feet at a time, and then just gets in touch with what gets brought up when they move closer, to sort of explore what happens with getting closer and being distant. And I have other exercises involve someone maybe standing or whatever. But I found that I've been able to do those telehealth. Maybe a little, it's a little trickier, and it's a little more, you have to be a little more creative. But I found that I can pretty much do what I do in the office with telehealth, and so that's pleasing to me.
Oh yeah, that's fascinating to me. I think back to my mentor, Dr. John Edwards, and one of the techniques he developed was called New Talk, where you go, as the therapist, you go stand behind the person and with their permission, put your hands on their shoulders and support them in saying something new to their partner. And virtually that's somewhat
right.
I haven't wrapped my head around that.
Right, that's a little tough, right?
Yeah. Or I know Salvador Minuchin used to mirror the behavior of his consumers. So if the one stood up, he stood up. And of course, if you stand up on camera, you tend to get out of frame.
Right.
So, it's, again, I've not done it. So it's real interesting to me to hear how you've adapted to that, being able to do that, to be creative. And I don't know, I find that to be exciting. I hope you do, in that it's new ways of providing our services. Yeah.
Oh, yeah. Well, I'm just struck by, because, when we look at some of the cons, which is like, to me, I guess the biggest would be just that sometimes there's technical problems, like someone's camera doesn't come on, someone's mic doesn't come on, there's a frozen frame for a while, there's a disconnect. But, at first it's kind of like frustrating just because we're not skilled at it. But, after a while, it's like, refresh, go out, come back. I mean, you just know what you need to do, and it self-corrects, and it gets taken care of in a couple of minutes. And it's a really minor distraction. So, that's kind of a relief to know that when things come up, they don't have to derail the session at all, So that's been good. And like I was saying, maybe the con of not seeing as much of the body can be offset by seeing more of the face. And I think one of the things that I just have to address once in a while is if someone's in their home, maybe they're homeschooling and kids are in the house. And so sometimes there can be a little distraction, and then there's pets, that kind of get involved. But actually that all ends up being okay. I mean, it's kind of part of getting a feel for the person, and it works out. I mean, so yeah.
It gives you a wider sense of what their family life is like, that you wouldn't get with them sitting individually or as a couple in your office, for sure. Yeah.
Right.
let me just throw this out. This is an observation I think I've made. It's certainly anecdotal for sure, but I've particularly some of my mid-age, older consumers are still threatened, ill at ease with the use of technology. And so one thing I provide that I'm happy to do is some coaching, and here's how it works. And yes, you can do this. And the observation I feel like I'm making, something I'm trying to keep an eye on, is it seems to me that when people successfully negotiate this new skill, that they come away with some level of new self-empowerment. And being in the addictions field, yay!
Yeah, right.
I'm really happy to see that. But
right.
I mean, that's generic. But yay! Have you been aware of that or noted that at all, or as far as people's feelings about self when they finish for the first time?
Well, I'm probably assuming that often. I'm more aware of them just being excited when it works out. So I certainly see that, where they're saying, wow, we worked this out, or this, I was able to solve this. And so, so they may not verbalize, I really feel good about doing this, but I can tell just by their response that that's true. Sure.
Okay. Good. All right. Yeah, that's just something that I began to be aware of, and I'm just trying to keep an eye on it just to see what comes of it. Do you have any? Well, I wanted to ask you one other thing. Telehealth. I probably want to ask you a whole bunch of other things, but time will constrain me. Telehealth, we know, is not for everyone. Do you do anything in particular to assess for the appropriateness of it, or do you get into it and start it and maybe this isn't the best idea, we ought to talk about it, kind of thing? How do you approach that?
Well, when someone first calls me and I give them a choice, and if they say they prefer doing the telehealth, I mean, one of the first things I say was probably the most important thing is that you have good Wi-Fi, because lots of times people will have Wi-Fi, but it's not that good.
Yeah.
And so probably that's the first thing, is it may not be appropriate if they don't have adequate Wi-Fi. And, I've had people that start out in their home, and then literally, of course, many of them go out on their porch because it's better, but then some will actually get in a car and, drive a little distance, and they'll do it in their car. So, I mean, they make it work. And the other, I guess, would be to make sure wherever they are, they feel it's really confidential. And that, because sometimes, I mean, I've been surprised where all of a sudden, like, their spouse walks through the room, and I'm thinking, well, how was that? How do you feel about that? And so, but usually most people find some kind of a setting where they can close the door and, be by themselves or whatever. So I think that's important. I guess, I mean, part of it for me is I really try to encourage people to try it, just because of the common experience that it's usually a better experience than they expect. So, I mean, I'm fine if they decide they don't like it, but I'd rather they decide after they've tried it than before they've tried it, because oftentimes they're very surprised. And also, there's some other benefits too, like, if someone goes on vacation, it kind of feels like they can do a regular session now, and because they can just do it by telehealth, at a distance. And so, I think, my only concern, I think, what you're saying, another factor would be, if someone's at a great distance. I mean, most people I see, of course, are in this area, or, maybe a little bit in the region, but if they get at a distance and they're in a crisis, like you were talking earlier, if couples, are really, there's a lot of conflict or whatever, the further someone is away, the more likely I don't really know the resources in that area. So, so it's really nice if they're close, I can say, well, contact so-and-so, or, these are 2 or 3 agencies or some people that would be helpful. But at a distance, I'm not able to do that, So sometimes if someone's in a crisis and they're at a distance, I choose not to see them just because I'm afraid I can't really quickly give them what they need. And sometimes they need someone to give them a resource right away, not just say, well, Google it or, whatever.
Yeah. Right. Yeah. Yeah. And that opens up a whole another topic that we don't have time to go into today, and that's having emergency plans.
Right.
But maybe we'll do this again and talk about emergency plans later. If people, there's likely somebody out there watching this who's just starting in telehealth. Do you have 1 or 2 particular hints or thoughts about how to make it a success getting started, something you've learned?
Well, I'm assuming they would already do this, but of course, when I started, the program I chose, which was Doxie.me, and was used a lot by the medical profession. Of course, the first thing I needed to know was that it was encrypted, and for confidentiality reasons. So you certainly want to know that your platform does that, and then and I've just had great. To me, if something happens and I need to call, I'm amazed that they respond literally within a couple of minutes. I don't have to wait on the phone like half hour or 45 minutes. And they're very helpful. Well, I guess, and I know clients like to hear, but I know it's true for most formats, is I can say, you don't have to know a meeting number. You don't have to know a password. All you do is click on a link. So it's very easy. And in fact, you can use an old link. I send people links each time because I think they're used to, catching that on their email. But if something happens and it's lost or deleted or whatever, they can just go back to a past one and join, the same way. So anyway, it's a pretty easy process. But I like the idea of also, if they're starting, to maybe encourage a hybrid, say, maybe this is something that, you might want to come the first couple of times, or you might want to telehealth and then try it both ways and then go from there and see,
Yeah, excellent. Okay. Well, our time is running low here. I don't know, are you accepting new clientele at this point? And if so, would you like to share with how they might get in touch with you?
Well, I'm not really accepting new clients at this time, although I'm prone to pick up a few couples as I go along. And I'm fine with sharing my number, but I don't want to misrepresent, because I haven't, my number is 828-586-8700, but and I'm connected with Western Carolina Counseling Services. So yeah, I do want to say that, but kind of in closing, I do want to say that under the concept of what's better care for our clients, I want to say that, people at first might think, well, it's better care if you're in an office because you have more contact and you have a better feel for the client. But I'm going to say that's more than offset by telehealth, which, if it gets people to come more often and for more sessions, then even if it's let's say 95% is effective, well, you're going to get a whole lot more out of it by coming more often and more. And so that in the big picture, I think it really provides more service to more people at a high quality than it would if you had maybe a slightly higher quality, but you had a lot less attendance. There are many couples I know I would not be seeing if it wasn't for telehealth, because it would be just too hard to combine their schedules and to have one that maybe isn't as enthusiastic about it to commit to coming. So I think it's important to see that in the bigger picture, it actually adds a great deal to, I think, to personal growth and change for people when telehealth is available.
All right, outstanding. Well, let me thank you again for spending your time with us and sharing your expertise. This was very interesting, and I loved hearing the takes on doing couples work. Hopefully, we'll get some folks who will leave some comments, and if so, I'll see that you get those. Okay. And if you are watching this video today and you enjoyed it or didn't enjoy it and would like to leave a comment, please do so in the comment section. But also, please consider hitting that subscribe button and joining us for our ongoing series on providing telehealth and a new upcoming one on processes in recovery. So, John, thank you again. It's greatly appreciated. I look forward to talking to you soon.
Thank you very much, Cecil. Okay, bye.